On Monday, around 15,000 nurses in Minnesota walked off the job after months of failed contract negotiations. Now, members of the Minnesota Nurses Association last month had voted overwhelmingly in support of what the union says is the largest private sector nurses strike in U.S. history. Now, they say they did this because of the hospital's habit of putting profits over people, which, again, in the American healthcare system is not entirely surprising. Now, nurses with MNA argue that hospital executives who make millions of dollars per year, and I'm going to go through and detail some of those figures are just gigantic. They refuse solutions to short staffing, retention, and better patient care. So look, what we saw during the pandemic, of course, is you had nurses, you had hospitals that were stretched to the breaking point. You had medical officials that were dying from COVID before they had vaccines. And so, shoot, and even afterwards, but, you had all of this burnout as well from nurses and staff that were just overwhelmed with the amount of people, patients that they had to see, and the amount of death and suffering that they had to watch, because there wasn't a whole lot they could do about it in a lot of these cases. So following that, and again, being called, heroes, nurses and you're the heroes of the hour, and then not paying them and not ensuring that they have time to be able to unwind and process the things that they've seen, or to even take care of their own families. No, that's ridiculous. But again, it's indicative of what we see all the time in our American healthcare system. So now that said, Chris Rubesh, MNA vice president and a nurse at Essentia Health in Duluth, told the Washington Post that he supports a 3-day strike. So this is what they're doing. They're just taking strike for 3 days. So now that's a lot. Of course, it's going to impact patient care, of course, but understand that while they don't want to have to impact patient care, at this point, they've been given no choice. They have to do this in order to make their demands clear. And so I guess I understand, like, on the one hand, it's like, oh man, these people, these nurses there's still patients need to see, and it's going to impact their healthcare. Yes, that's true. But you also have to be on the side of the nurses, because they're not getting what they deserve, what they actually need to do their job effectively. So now, Rubesh has an example of this. He says, call lights go unanswered. Patients should only be waiting for a few seconds or minutes if they soiled themselves or their oxygen came unplugged or they need to go to the bathroom. But that can take 10 minutes or more. Those are things that can't wait. And again, that's not because the nurses don't want to do this. It's because they're overwhelmed with the amount of patients and the amount of work that they have to do. Minnesota Reformer reports that in addition to demanding staffing fixes, and this is what they're asking for, paid sick and parental leave, nurses seek a 30% wage increase over the next 3 years. So that is 10% each year. Hospitals have countered with just a 10% flat increase over the next 3 years and say that, we just can't afford to get any higher. So now let's get into the numbers, right? Where we can find maybe some of that money. Essential Health Services actually have paid their CEO, David Herman, about $2,697,603 in annual compensation. You know how many more times of pay that is compared to the RNs? About 31 times. CEO makes 31 times more a year than the RN. Is the CEO doing 31 times more work than the RN? Are they getting 31 times more burnt out? Are they changing 31 times more bedpans? No. They're not doing anywhere the equivalent of the work that these nurses are doing. And they're getting paid 31 times more. No, that's a huge problem. But there's more. The executive VP, Jody Mansfield, makes about 17 times more than the average RN. bringing in nearly $1.5 million in total compensation. And then you have the CFO, Human Resources Chief, and Population Health Officer make around 8 to 10 times more than the average RN, somewhere around $700,000 to $800,000 per year. Gee, I wonder where we can find the money to pay the nurses. And it seems like all you have to do is just maybe trim some of that excess fat off of these CEOs, off of these highly paid executives. Why is there an executive CEO that makes almost $3 million in a year? Now, let me give you more information. Alina Health. This is the one of the hospitals that has striking workers. Here is how much the former CEO and board member, Penny Wheeler, receives in annual compensation, about $3,241,167 per pay, compared to the average RN is about 38 to 1. And the other executives, again, making millions, and on at pretty much all of these different hospitals where you have these striking nurses. Now, of course, you have the hospitals. They're not blaming the CEO, these executive pay. No. They're blaming the workers, the nurses. How dare you? Oh, you're asking for too much. In fact, spokespeople for Alina Health and Twin Cities Hospital Group, two of the systems where workers walked out, said that they refused to go to mediation. Oh, they wouldn't mediate. They wouldn't talk to us. Really? There was negotiations, and the hospital said, no, we're just going to give you 10%, and that's it. We're not going to fix anything else. We'll just pay you a little bit more, and then we'll leave it. Well, that's not going to fix the staffing issues. It's not going to fix the fact that they're not doing good patient care because they don't have enough people, and they're getting burnt out. Now, striking nurses say that the walkout was forced by management that was intractable. In fact, here's Brianna Nath, a nurse at North Memorial in Robbinsdale. Quote, we're really sad and disappointed that it has come to a strike, but we feel like this is the only thing we can do now to show the administration how incredibly important a strong nursing corps is to a hospital. Hospitals tell us it's our fault, but we've been actively involved and getting nowhere. That's unfortunately how it goes. And until now, they haven't had any media attention. But this is where they actually did get some media attention, because you had high-profile politicians that actually have stepped up. I'm going to give credit here to Minnesota Attorney General Keith Ellison, who, of course, is a huge supporter of the nurses and their walkout. And then, of course, you have Ilhan Omar. Here's what she tweeted. I'll be outstanding in solidarity with our nurses at Abbott, Children's, and Fairview today. Come join us and show your support. That's good. And then, of course, Senator Bernie Sanders, who tweeted this. I stand in solidarity with the 15,000 MN nurses on strike this week, fighting for safer care, fair scheduling, and higher wages. Nurses are the backbone of our healthcare system, and they understand what's best for their patients. Wonderful. So, look, that's how you get attention, right? And it's good that they have this attention coming from these high-profile politicians. Wonderful. Look, again, it may not be much, but just acknowledging that these things are happening, acknowledging that there is, a strike that is going on, because you have people that are not able to do their jobs well enough, because they don't have the resources, they don't have the pay. Again, they're getting burnt out, etc. And while these same CEOs of these hospitals are getting paid millions and millions of dollars in executive packages. You got to point that out. And I'm really glad that Ilhan Omar, Keith Ellison, and Bernie Sanders are doing that. Otherwise, let's be honest, it might have not gotten picked up by the story, or picked up as a story. Because, look, mainstream media doesn't like to do stories on unions. They don't like doing stories on labor strikes. And oftentimes when they do, usually there's a perspective on it that happens to be the corporate perspective. So when these politicians, and this is why it's so important for progressives to have a platform and to use that platform to continue to elevate strikes, which again, we've seen again with the Amazon labor union, being supported by Alexandria Ocasio-Cortez, and other politicians. Again, Bernie Sanders, who always seems to speak out in favor of a lot of these strikes, or many of these strikes. That's a good thing. You need to have that, or else mainstream media is not going to talk about it. They're not going to cover it. They're not going to, try to bring any attention to it, because they are aligned with the large corporations and the bosses. The people who, will try to shut down and bust those unions and ensure that these workers do not get what they're asking for, which again is just like the basics to do their job. They deserve that. So, look, I love to see it. Again, nurses, they're the backbone of the medical field. They deserve better pay. There does need to be more staff, because that actually is better for the patients as well. If the executives actually gave a damn about the patients like they're supposed to. Again, your hospitals are supposed to care about patients. Instead of seeing them as just a number on a screen, well, they would be making sure to give nurses and medical staff everything that they need to do their job effectively. But we know, again, sadly, like everything else in this country, it's become a commodity. Healthcare has become just for profit. Now, I happen to believe differently. I think that healthcare is a human right. I think it's a human right, just like shelter and food. And I think that there's no reason in this country or anywhere else that we should not, as human beings, shouldn't be entitled to have the very basics that we need to survive.